Dr. Burstein, my goodness, it's kind of got crazy again. Thanks so much for joining us on AM Buffalo.
Yeah, thanks for inviting me.
I'm super excited for the holiday season coming up, but this year it's going to be a little different. And I've got to say the message is really confusing because health has become politicized, and there are some people saying, forget the rules, and some people saying, please do this. How do we cut through all of this noise? What are we meant to be doing this holiday season?
This holiday season, we just have to remember to believe in the science and listen to the science and what the science tells us. And, what we've seen in our community and the rest of the United States is that if we have like a large number of people or even a small gatherings of people and somebody in the room has COVID-19 and many times, nobody is symptomatic, that will spread very, very quickly. And we also know that there are a lot of vulnerable people in our lives that could become very, very ill and require hospitalization and even die from COVID-19 if they get infected. So this year, I think we should think about having a different type of Thanksgiving, a small Thanksgiving. It's safer if we have the actual dinner, the meal with just people that live in the household and share in the celebration virtually. We know that we have so much COVID-19 in our community, and even small gatherings we're seeing outbreaks from. So we're calling them living room outbreaks.
In preparation for Thanksgiving, should we be going into quarantine? Should we be getting a COVID test? Is there anything that we can do to limit the spread?
Well, you bring up a good point. So, some people, really feel for whatever reason it's important that they get together with people from maybe from their family that they don't live with. There is a strategy to deal with that. Everybody should quarantine for 2 weeks' time. Also getting a test at the end of the 2-week quarantine period is a good idea. However, we can't test our way out of this. So say you're getting a test in preparation for Thanksgiving. You get a test, say, on Monday or Tuesday, and it's negative. That doesn't predict that Thursday that you would still be negative because you're not getting tested on Thursday. The safest strategy is to have a small Thanksgiving dinner, celebrate in person with the people in your household, and then have a super expanded cross-country, maybe even global Thanksgiving get-together virtually with all the people that you really want to see.
Well, and I'm the expert with virtual global get-togethers, so I speaking from experience, it actually can be a lot of fun.
Then also,
Thanksgiving,
there's less to clean up. And there's less leftovers.
Yeah, it can actually be nice. Maybe this year is a good time to just take a step back and have a little selfish, some champagne and some mac and cheese for yourself.
We're toying with, having a fillet instead of turkey. But again, there are plenty of opportunities to celebrate with friends and families. This year, it's going to be virtual. And then, and we're doing this as an investment. So next year, we will be able to have everybody at the table because we will have all gotten through this COVID-19 pandemic.